This is one of the most fantastic things I've ever seen in my medical career.
Chief of Infectious Diseases at the U of A, Dr. Elizabeth Connick, is talking about the 2 COVID-19 vaccines now being given to frontline workers and those in long-term care facilities.
Not one, but 2 home runs. And no one could have even imagined that we would be so lucky to have this great success.
The Pfizer and Moderna COVID vaccines have gone from design to emergency approval in just 10 months. That has led to some questioning safety.
The vaccine was developed very quickly, but there have been no shortcuts in terms of the approval process. The data were very seriously scrutinized by the FDA panel.
There was a handful of vaccine trial participants who suffered side effects, including Bell's palsy, a temporary weakness or paralysis of the muscles in the face. The rate of Bell's palsy was not significant, according to Dr. Connick.
The frequency was very low, and there's not evidence that it's more frequent in vaccinated people. It's a pretty rare event.
Another concern about the COVID vaccine involves people with underlying conditions and their fear to get the vaccine.
People with underlying conditions should get the vaccine because they're more likely than other people to die from COVID-19. There's no risk. There's no live virus in these COVID-19 vaccines. There's no risk to people who are immune compromised or have other medical conditions.
There are also several myths circulating about the COVID vaccine. One says the vaccine will change your DNA.
That's completely untrue. There's no DNA involved with these vaccines. They're RNA vaccines, and RNA will briefly get into people's cells and provide a template in order to produce the proteins for you to develop an immune response, but the RNA rapidly degrades. It does not become a permanent part of your genome, and there's no DNA involved whatsoever.
Another myth circulating on social media says the COVID vaccine contains a microchip planted by the government to surveil Americans.
That's just silly. There's no microchip in the vaccine. Microchips are much bigger than can fit in the syringes that are being used to inject people with the vaccine.
A much more valid concern involves those who've already had the coronavirus. Should they receive the vaccine?
It's generally recommended that people who've had COVID wait for 3 months before they get vaccinated, but the guidelines now recommend that they get vaccinated to make sure that they will have good high levels of protective antibody.